When it comes to this app, how many people are going to have to use the app for it to work?
Well, I think the app can work, independent of how many people use it. But I think in order to encourage people to use it, we need to explain what the app is for and why this was developed as a public health strategy. So the problem that the app addresses is the transmission of this virus, of the COVID virus, is that about 50% of transmissions occur before symptoms. So it's a very rapidly transmitted virus, and some people have very mild infections. So the issue is that contact tracing is about identifying people who are at risk of transmitting the virus. And the traditional way of doing it, which takes several days, which we were modeling at the start, just isn't quick enough to get the message to people that empowers people to not go on and spread the virus. So the app is solving, a specific problem, which is how do you get the message that you're at risk and empower you to take measures to protect, your friends, your family, your colleagues, and the people you've been in contact with. To help spread the virus.
But for it to work in the population, lots and lots and lots of us are going to have to download it on our phones and go out with it. I ask again, roughly speaking, what kind of percentage are going to have to be using this app for it to really crack the virus?
Well, so the app is going to be one of the building blocks of how to get out of the epidemic. And we have sort of two estimates. We found that when we projected over the next 3 months, for every 1 to 2 users who download the app and who adhere to the instructions, you'll prevent 1 infection. And we found that for this intervention alone to stop resurgence of the epidemic, about 60% of the population would have to use the app. Now, that number may be a bit smaller if there are other interventions going on, which we hope there will be: social distancing, large community testing, and indeed manual contact tracing.